Okay, so moving on to the pandemic, coronavirus cases are surging to new highs yet again. The U.S. set a couple of new records for cases over the weekend, with more than 83,700 new cases on both Friday and Saturday. Cases are currently rising in 44 states, and this spike is different than the last one in that more rural areas are being hit hard. Folks in El Paso County in Texas are under curfew right now, as the surge there has left hospitals and ICUs at full capacity. The curfew is from 10 p.m. until 5 a.m. But there is some good news. Dr. Anthony Fauci is now saying that we'll know if there is a safe and effective vaccine by the end of November or even early December. But it may be a few more months after that until there are enough doses for everyone. Jeff, what do you make of this new surge in cases? Are you ready for gyms, restaurants, and bars to shut back down? Will this time be different? Will people actually abide by wearing masks and social distancing? What do you think?
Listen, this isn't advice, this is an opinion, so don't take this, I don't want people going off on this, but I think people are starting not to care. I think they could beat it, and they're like, listen, if I get it, I think it's just a matter of time till I get it, or if this vaccine is gonna come out. One is gonna happen, or the other is gonna happen soon. And I just think people are letting their guard down, and they don't care about the social distancing, they don't care about the gatherings anymore. I think they're gonna go on with their holidays, and I think if people got it already, I think they feel like they're immune for the rest of their lives, which we still don't know if that's the case.
Erica?
I think a lot of this goes back to what our own Dr. Coley said about the idea that people are really kind of being social in these smaller groups, thinking that it's safe. And the problem is you have people who are being social with other smaller groups, and you're cross-contaminating between the two groups. I think the idea that it's spiking in rural areas is probably indicative of that. You don't think about your social distancing as much because the population isn't as great, and maybe you aren't that close to where your neighbors are. But if your family's getting together for Sunday dinner, and even one of your nephews went over to his friend's house, and now you have this cross-contamination thing. I know that in Canada, I was speaking to my mother-in-law, in their area, there's been a bit of a spike for the first time in a long time. Well, what just happened? Canadian Thanksgiving. And you're not thinking like, I got together with just a small group of family, but it still happens.
Yeah, listen, it's scary, and a lot of people, to Jeff's point, it's either they're over it or they don't think that it'll happen to them. You're just one case or one person away. I mean, our direct neighbor just had it, and it hit him really hard, and it was scary knowing that he is just a matter of feet from us. And also, too, I think we need to remember that healthcare workers are starting to be overrun again.
Yeah.
We all know a healthcare worker, right? We all know a nurse, we all know a doctor, we all know somebody that works as a healthcare worker, and they also need our help so that they can be protected. So let's think of them as well. Jeff, lots more to talk about coming up on DBL. Harry learns a powerful lesson about